But the idea behind that is if you can design work from the outset that we know is actually going to be good for people's mental health, then you're going to have higher levels of productivity, engagement, and less psychological injuries. Yeah. So it's like designing your or engineering, I guess, your physical work environments, understanding that, you know, there are common hazards, so let's control them from the outset. It could also be, I know you've got a bit of experience in the fatigue space as well, and I really like the comparisons we can make between fatigue risk management and psychological health and safety or psychological risk management, in that both are unseen, right? We still can't measure fatigue very well, okay? So fatigue measurement's an issue, and it's hard to, I guess, get an objective measurement of how mentally healthy or ill someone is as well. We rely a lot on self-report for both.
Yeah, very much so.
And really, when it comes to fatigue risk management, we focus on things like biomathematical models of sleep, wake, and that sort of thing to try and determine what is safe for the majority of people, right? Yeah. And so work design is very much going, well, we know things like having autonomy in someone's role, having a sense of mastery, using your strengths, having positive relationships in the work environment. They're all good for mental health. So let's design jobs that have those things in them to begin with.
Yeah, absolutely. Autonomy, the right level of challenge, not too much. There's the Goldilocks zone of workload and all of those types of things we know are beneficial. So they're actually protective of mental health.
Yeah. So, you know, we don't have to wait for people to start getting ill at work, right? Before we start intervening, we can design work, and this is at a systems level, you know, to keep people healthy.